Thank you for having me. Yeah, I've done a lot of work with patients who need help kind of distinguishing why they're falling. It takes some time to kind of weed through all the variables. So, I think that's an important thing to discuss, and you want to, if you are struggling with falls, you want to kind of try to figure out why. Right? So there can be multiple reasons why, but and we're going to talk about some of them today. But it can be multifactorial too. So that is something just to sort of keep in the back of your mind. It's not just one thing sometimes. So, okay. Facts about falls. They're very common among older individuals. Well, actually, before I get started, how many of you are caregivers in this room here? Okay. You're caregiving for somebody who, yeah, okay. So 3 of you. Okay. All right. Falls are very common. We know they can lead to physical injury. We know they can lead to psychological trauma. It's important to be aware of fall risk because it can lead to high rates of mortality and morbidity, okay? Oftentimes, 1 in 5 falls causes serious injury, not just to broken bones and other, orthopedic issues, but it can lead to head injuries too. So it's very important. If you've fallen and you have hit your head, you probably should get checked out. I've had, I was treating the wife of a gentleman who had taken a fall, and he had hit his head. He fell down the stairs, actually, and he hit his head. And she got him up, seemed like everything was fine. He seemed cognitively aware, and later, she had to rush him to the hospital because he had a slow brain bleed, and he eventually passed away. So it's important, if you hit your head, you probably should have an assessment done. You should probably make sure you have a scan done to make sure there's no slow bleeds, okay? So head injury can be common, and I just want to, it's not something to take lightly. So please, if you do hit your head, you want to be checked out, okay? We know that they're the leading cause of injury death in older adults, okay? By the year 2030, there will be 7 fall deaths per hour. And that's according to the CDC. Okay, so this is something to, be thinking about as you age. We want to be thinking about how to keep ourselves safe, how to keep our loved ones safe. Okay, that was a shocking statistic to me. Okay, so I included it here because I think it's important to realize the impact that these falls can have. But also, even if you don't sustain an injury, it can create psychological trauma in that you have a fear of falling. And fear of falling is a risk factor for falls. I see it all the time in my patients, it's like, okay, we're going to put a gait belt on, you've got your cane, we might be, trying to transition from a walker to a cane, something like that. They're very fearful. Their steps are small, they're shaky, they're holding their breath, they're traumatized by the thought of having to take some steps without assistive devices and things like that. So the fear is a big factor, and that's something that, you want to sort of overcome if you are having these fearful thoughts about falls. And if it's affecting your confidence, you want to get out there and do something about it, okay? What causes higher than average fall incidence rates among older adults? There's lots of causes. Advancing age, declining physical function, okay? A lot of time when you are more sedentary, you lose your ability to maintain your posture, or how do I maintain my center of mass over my base of support, right? There's a loss of the ability to kind of deal with sudden changes and other things. Again, you have a fear or a lack of confidence in the activities you do. There's intrinsic fall risk factors. What's an intrinsic fall risk factor? That's something internal, a disease-related change, an orthopedic injury, something of that sort. Okay, external factors have more to do with your environment. The indoor environment, you know, what is your home like? The outdoor environment, you know, is there a raise on the sidewalk as you're walking through town? And also, how risky is your behavior? Are you getting on the ladder to go and clean out your gutters? And you haven't done that in a long time. Like those, you know, making sure that you're being thoughtful about the things that you're doing is really important. Let's see, what's going on here? There we go. The level of fall risk is not the same. And it can change over time. I've seen people go from a high fall risk to very minimal fall risk with putting in the effort and work that they need to and making some changes. But it can also change depending on where you live. If you're someone who is in a long-term care facility, well, you're not going to have the external or the extrinsic environmental risk factors of somebody who lives out in the community on their own or in their own home, right? So those people that do live independently, we want to be looking at all those external risk factors. So if you're a caregiver and you're, you know, thinking about, okay, where is my loved one? Are they in a long-term care facility? You're not going to be as worried about the environmental risk factors. You're going to be more worried about their intrinsic risk factors. What is the disease process going on? Are they getting enough exercise? Those types of things, okay? Okay, so let's dive into intrinsic risk factors. These are related to age or disease process, like I said, orthopedic injuries, that type of thing. You're at higher risk if you're 80 years old or older. Higher risk. Also, females are at higher risk, okay? Your functional level also is something to be thinking about. Do you have a history of falling? That is probably the #1 thing that we look at as far as making an assumption whether someone might fall in the future. So if you've had a fall, you're more likely to fall again unless you do something about it. Increasing, yeah, go ahead.
Why are females more likely to fall?
Why are females more likely to fall? I would probably say it has to do with strength and just different daily functional activities, right? Yeah, also I think the way that, you know, females have a wider pelvis, and I think their hips tend to be a little bit weaker than males, so I think that's probably part of it. Yeah, Julie, do you have anything to add about that?
Where are you?
Why females might be more at risk for falling? I thought maybe, you know, wider pelvis, less hip musculature, possibly. Multitasking, right? Yeah, yeah. Okay, so that could be very true. Right? All right. So, you know, and also just increasing difficulty in doing your daily activities.
I have a question. Yeah, there is another reason why females are worse. They have osteoporosis.
They might be more
Yes.
at risk for greater injury,
Yes.
for sure.
They have
But men do lose bone strength. So, yeah, I think there's some hormonal factors there. But why are women falling? I understand that, I think that leads into some of that. Also, I think the fear factor also plays a role, right? And like Julie said, if women are living longer, are they living alone? Yeah. Right? So those are things to be thinking of. Sometimes people don't use their assistive devices properly. Canes and walkers, maybe they're in poor repair, right? They're not set at the right height. Maybe they haven't had an evaluation with the physical therapist to determine if it's the proper height or the proper piece of equipment. I mean, I see canes all the time that are four-pronged. You'd think that'd be a larger base of support. Well, some people just use one prong of the four. They're not using it properly, right? There's also devices you can buy online to stick on the bottom of the cane, and sometimes they teeter. So, are you using it appropriately? So that's where a physical therapist can be very helpful in helping you determine, is it set at the right height? Is this the right piece of equipment? Rollator walkers are great, but are you using the brakes appropriately when you need to, right? So, or do you sit down and you don't have the brakes on it? Those are all things that, can play a role.
What does the acronym ADL stand for?
Activities of daily living, like your basics, going to the bathroom, getting in and out of bed, transferring to different surfaces, walking around, right? Those are your basics. Taking a shower, yeah. And then we talked about lower levels of physical activity, okay? Some additional intrinsic risk factors. How is your general balance? How is your strength? Do you have impaired reflexes? Maybe your reflexes aren't as quick as they used to be. Are you a slow walker? Do you take narrow steps, right? We like to see a bigger base of support under people. Do you have more postural sway? So that when you do transfer your center of mass, is it too far beyond your base of stability that you then lose your balance, right? Chronic illnesses. All of these conditions can lead to increased fall risk for various reasons, right? Heart disease or problems with blood pressure changes, right? That's also under medical conditions here. Parkinson's disease. A lot of people don't pick their feet up. They shuffle. They get their feet caught, or they have episodes of freezing where they can't get over a threshold, right? Lots of other neuromuscular diseases that can cause problems. Stroke, obviously, maybe one side of the body doesn't work as well as the other. It could be strength, it could be sensation. Urinary incontinence is a big one, because if you're rushing to get to the bathroom and you're not paying attention to what you're doing, you might fall, right? So if you do have incontinence problems, maybe it's just beneficial to wear something underneath your clothing so that you don't have to rush, right? So those are important things to keep you safe. Obviously arthritis, right? We have lots of hips and knees that we see. People that struggle with, very intense pain in those joints sometimes. And of course, acute illness. Are you dehydrated? Have you had the flu? When you get up quickly, are you struggling to kind of find some stability? Those are all things to be thinking about. Foot problems. Diabetes, right? Loss of sensation. There's lots of reasons why you can lose your sensation in your feet, but those are things that we really like to make sure people see podiatrists and check in, right, to see how their foot health is. Continued risk factors, intrinsic risk factors, medications, alcohol use. You're going to have a more in-depth conversation about medications, but the number of medications if you're on, more than 3 to 5 medications, you can be at a significant increase for falls, just by that alone, right? You want to talk to your pharmacist. You want to see what kind of, interactions the medications have. And the type of medication can increase your fall risk. You got to read your side effects and know. Yep.
So that's the subject of the 4th lecture.
Yep. Yeah, so that'll be covered more in depth later, but it is something we want to plant the seed and have people be thinking about. Sensory disturbance, okay? When I see people for assessment for fall risk or balance troubles, we're looking at the different sensory inputs that go into the brain and the nervous system, right? You have your vision. Is your vision declining? Do you have something going on with your vestibular system? Okay? That's going to be another discussion, another topic for the lectures. But, the vestibular function weighs very heavily on balance problems.
What is it?
It's the inner ear, a sense of kind of where we are in space, our sense of movement. Okay? All of these things have to coordinate together so that your brain can process it and spit out a command, right? So we're looking at all of these things. The amount of sensation you have coming up through your feet. This is loss of sensation or proprioceptive loss is very debilitating for people, okay? So oftentimes I have people ask me, can we make improvements on that? Not really, but what we can do is help you compensate for that loss so that you learn what are other strategies you can use to keep yourself safe, right? Mental status, cognitive impairments such as dementia, depression, poor judgment, those are all intrinsic risk factors. What are the extrinsic risk factors? These are the environmental hazards. In the home, it could be ground surface, right? I'm sure a lot of you have heard throw rugs are like a no, you should not have throw rugs in the house. If you do, you want to make sure you got sticky tape and those edges are not coming up. You don't want your toe getting caught on an edge of a throw rug, right? We all trip on things. Do you have cords sticking out? Is there a place around your, maybe you don't have much room around your desk space and you got a cord to your laptop, and I just did that the other morning, got my foot caught, and it's like, you got to really be careful. Do you have things cluttering your pathways? Do you have furniture that's misplaced? Do you have piles of books or papers or other things? Are there things for you to, that kind of get in your way? You want to be thinking about that. Do you have good lighting in your house? We really like to see people have night lights so that when they wake up in the middle of the dark to go to the bathroom, there's some sort of lighting that can help guide their way, okay? Your bathroom, do you have a safe bathroom? Do you have towels on the floor? Do you have grab bars where you need them? Do you need grab bars? If you do, you want to think about who to contact to try to get some of those accommodations made. Environmental hazards in the community. The sidewalk, right? There could be a break in the sidewalk, roots pushing the sidewalk up, different surfaces you're walking on, grass or mulch or, any number of things. Those are hazards, right? The access in the community, are the stairs compliant? Do you, is there a ramp available to you? You want to just think about all these other, things that could be creating a bigger risk of falls for you. This just kind of goes a little bit more into what we had talked about already. Loose carpets, carpets that are starting to come up and you have wrinkles in your carpet, you want to think about that. If your stairs are in poor repair or if your floors are slippery, you want to think about that. Or what kind of shoe wear are you wearing in the house? Is it appropriate for the type of floor that you have, right? Is it going to create more friction, or is it going to be too slippery, right? So things to be thinking about. We talked about clutter. Unstable furniture is another one. Low-lying furniture like low coffee tables and not enough space between your couch and a coffee table. Those are all things to be kind of cognizant of. Do you use chairs that don't have armrests on them? Or do you have an office chair with wheels? Do you lock the wheels, right? You want to be thinking about those types of things. Beds that are too high or low, cabinets that are too high or low, okay? Not only, and with lighting, it's not only dimly lit rooms, but also, is there a glare from your windows? Can you pull your shades down at certain times of the day so you can see well in your home? And then we talked about the different changes you can make in your bathroom. I think this lecture is going to be available online for you guys too. So, yeah.
You forgot pets.
Oh, pets are a big one.
Yes.
Oh my gosh.
Yes.
Yeah. You know, do you get a puppy? You know, if you're looking to get a dog, do you start with a puppy? Maybe that's not the best strategy, right? Yeah. Well, because they run around and the leash gets caught on your feet and, you know, do they pull you? You take them for a walk, do they pull you? I think animals can be so therapeutic for people, and it's great to have a pet at home, especially if you live independently. But you have to make sure you're making a good choice, and is the pet well trained, right? Excellent point. Okay. Yeah.
You gotta be, or I find it, you gotta be careful walking to here.
Getting here?
Yeah, going up the hill.
Yeah.
Oh, here. If I start to fall backwards, I cannot
Catch yourself. Yeah.
fix myself.
Yeah. Yep.
Yeah.
Going on an incline can be very, can throw your sense of balance off really easily because you have to learn to adjust your center of mass in relationship to the surface you're standing on. So yeah, can be hard. In that case, you know, you probably want to have an assistive device or some way to improve your base of support, right? But also, you know, the other thing about the community is like traffic lights. Is it too fast for you to get across the street in time, or is it a really busy street? Can you, you know, make some choices about where you're crossing? Yeah, we talked about some of these different ground surfaces. Ice or snow, that's a huge one, right? My dad slipped on ice, and, you know, it was like, he went off to the emergency room and had a fracture in his foot, you know, so we have to really be careful in those scenarios. If you're going on family vacations, you know, and you're going to be in the snow or something like that, make sure you have someone helping you get in and out of the house. Wet leaves, yep, that's slippery, yep. Varying curb heights, holes in the ground. We talked a little bit about, you know, the uneven surfaces. Oil spills is another one, right? So just being aware of your surroundings is important. So poorly secured handrails. Yeah, that's a bummer, right? Because they're supposed to be there to help, right? So, you know, just making sure you put just a minute. You take a little bit of a minute to understand what your environment is, especially if you're feeling uncomfortable, right? Okay, let's see. Sure.
I'm told that there is a right way of falling, and I don't know if I'm getting ahead, that you may talk about that later. Because I'm told that when you do fall, you should know how to, if you have time, to know how to fall when you do fall.
Yeah, that's interesting. I don't typically work with people on how to fall that often, although I probably should.
I'm told there are classes that
Yeah, I think curling in probably is smart. But Julie, do you have anything to add to that?
No, it's always preferable to not hit your
Yeah. So protecting, protecting yourself or coming in, right? And I think you have to be careful too, because a lot of times people have a tendency to fall backwards because our limit of stability is less going backwards than it is in the forward direction. Yeah. So I would, if I were falling backwards, I would throw my hips back to try to sit down, But again, that's a really hard question to answer.
Kids, I can remember a tumbling class that I went to when I was a
Yeah.
and they tuck
Tuck and roll.
practice. And I noticed like 10, 15 years ago, I took a fall off of a trail out in the woods, and I tucked and rolled. I fell 20 feet.
Wow.
And right down a very steep hill, and I did everything right. I had a big bruise on my leg, but I didn't break anything.
Got up and
I rolled fast, and my arms out, stopped, and I felt good about that.
okay.
That's what my paratrooper brother says.
Yeah.
Tuck and roll.
Tuck and roll.
And landing is hard.
Okay. I think.
My brother had an incident recently where he was walking, he liked to walk to the store and back, and he packed his backpack with something really heavy, and he was back heavy, and he kept falling the whole time, and he was trapped because he was halfway home, he felt like he couldn't get home.
So what do you think a good answer to that situation would be? Or put it on your front. String your arms through it this way and wear it in the front of you.
He wasn't thinking about it.
Yeah.
And he totally got panicky about it.
Right. Right. Good input there.
Our Tai Chi teacher here says lower your
Center.
knees and lower your weight a little bit. Stay upright.
If you're falling. Mm-hmm. Yeah, because doing the knee bend is a suspensory strategy. So one thing that we kind of go through in PT is we'll look at different strategies you can use to maintain your balance. So you've got your ankles, right? What I call it, you want to keep your hips and your torso in phase. So the ankle strategy is here. How well are your calf muscles working? How well are your ankle dorsiflexors working? When you go beyond that strategy, you have your hip. So the hip counterbalances the shift in the upper trunk, right? Or if you're going back, the hips come forward. So sometimes we'll work on using the hip strategy, okay? What comes after the hip? I'm going to lose it. I'm going to take a step. Stepping strategy, right? Okay, I lose my balance backwards. I want to get that foot behind me. So one thing you can do to practice, shift that weight back, big step behind you. You don't want to shift your weight and then take these tiny little steps. So if you have some ability to kind of practice that in a safe environment, you get better at it. There's more of these strategies to implement, right? The knee strategy, that's suspension. Sometimes people lock their knees. They're standing and it gets hard to stand there. Can you bend your knees a little bit? Give yourself some sense of proprioception higher up the chain, right? So those are different strategies that we use in the clinic. Let's see here. A lot of these we've talked about already. Climbing ladders, hurrying, running, those are things you got to really, those are hazardous activities, especially if you haven't done it in a while. One of the balance tests I use actually is like, can you jump? Can you actually jump? Now, and if you haven't done it in a while, don't go home and practice necessarily, unless you've got someone nearby. But it's interesting. People kind of lose that motor plan to do that, right? And that's also kind of a fear, too. Now, that's a very high-level balance test, right? So I wouldn't expect necessarily that everyone's able to do that, but it is, something to think about.
You've just given me a thought about jumping. So skipping would satisfy the jumping need and the mental coordination that you need not to trip over the skipping rope. So if you actually were able to practice skipping, would that help? It seems like it would.
It depends on the person, right?
Gotcha.
Yeah. And like I said, your risk for falls can change over your lifetime. I've seen people that are glued to a walker eventually make it to a push walker to a single point cane to nothing. But it's because they're devoted and they practice and they go to community classes and they keep working and working and working. You can't stop, right? But so maybe you're someone who can skip. I mean, we all know that there's, variabilities in people's function. So maybe so. Shoes are a big one, right? Making sure you have the right shoes on. Okay? I don't typically like slip-on shoes necessarily, right? Especially if you're not picking your feet up. Tennis shoes, athletic shoes, well-made shoes that stay on your feet, shoes that have a wide enough base to them. Sometimes you'll see these little sneakers where the tread is actually more narrow than the shoe itself. And that creates lots of instability for people, And again, back to foot health, do you need certain supports in your shoes? Things like that. So shoes are really, really important. Let's see. I think we covered most of those. Rising from a chair. One of the basic things you can do is just practice getting up and down from a chair, making sure that you can do that, right? And again, making sure you're not necessarily rising from a chair with wheels on it, or if you've got a chair, is it pushed up against something, right? So if you fall backwards, the chair's not going to go over too. It depends on the weight of the chair. So those are things to be thinking about. Okay. Any questions on intrinsic or extrinsic risk factors? No? All right. How do we prevent falls? Well, like I said earlier on, falls are multifactorial. There's lots of reasons why people fall. So getting some baseline is important, and that's why we really encourage people to look at a fall risk questionnaire. We've got those in the back, okay? Filling this out, seeing kind of where you stand. This will also help bring to light some possible situations you might run into. Once you do that, you might talk with your medical provider. Make sure you're talking about your medications. Maybe you talk to the pharmacist. You discuss any feelings of unsteadiness you have. Or have you fallen? Tell them. Let them know you've fallen. Let's discuss options. Why do you think you're falling? Can the medical provider guide you in the right direction? Am I dizzy when I transfer getting in and out of bed? Is the room spinning? Okay, well maybe there's a vestibular problem, or I'm not picking up my feet. Okay, well let's look at why that is, Lots of reasons. Do you have back problems? You might have a loss of nerve function, right? So there's so many reasons why it can happen. So it's really important to go see your medical people, right, that can help you. Preventing falls. I cannot emphasize how important staying active is. Keep your strength up. Make sure you're walking. Face the things head on that make you nervous. Go talk to somebody about how to address them, okay? Go see a PT. Get an exercise routine. Does it stop after 6 weeks of PT? No. You do your home program. And if you can't be diligent enough to stick with the home program, then go into a community class. Go meet with a trainer. Find ways to, keep yourself engaged and active, right? Find a walking partner. Go to a class with a friend. Group exercise is very, very powerful because people expect to see you. You make friends. People are holding you accountable, right? Have somebody that keeps you accountable. Have you gotten your vision checked, right? You want to check for worsening vision. Tint changing lenses, you want to be careful with those, going from outdoors to indoors. And are you, do you need to stop and let the glasses regulate before you continue on? Bifocals are also problematic, especially when there's a depth perception thing like going downstairs, right? You want to be thinking about that. Or are you focusing on near objects versus far objects? And how does that look for you? Again, having your feet checked regularly, and then reviewing a home safety checklist. We talked about a lot of the things that may come up in the home, but we also have a checklist back there. Go through the checklist, go around your home, see if there's anything that you could change to keep yourself more safe. Yeah?
Do you have any options for loss of sensation in the feet?
That's a really tough one. Like I said, there's not a lot we can do for that other than to teach you compensation strategies. So maybe it's an assistive device. Maybe walking sticks is beneficial because you can increase your base of support, right? We also might train the other systems that are working well for you. How do you use your vision more effectively? Can you strengthen your vestibular system to give stronger inputs to the brain, right? There's other things to do to compensate for the loss, but the loss of sensation in the feet is particularly debilitating for people, okay? The thing is that you've got to keep your strength up, especially with that particular issue, okay? Or I've got a gentleman right now, he had a spinal injury, he had to have a lumbar fusion, he's lost function in his feet, he can no longer use his calf muscles, right? He doesn't have strength in his calf, so he can't propel himself. So what do? We look at AFOs, an ankle foot orthotic that helps him propel when he's walking to keep him more balanced. So there are lots of other things that we can look at to help with those problems, right? Okay. All right, let's see. Okay, advice for caregivers. There's not a ton of caregivers in the room, but it's important. This can be a sensitive topic for older folks or people that you're caring for. They don't want to admit that maybe they've got a problem. And so you have to kind of tread lightly and sensitively, but can you help them sort of weed through some of this? Fill out the questionnaire with them. Use it as a way to guide your own observations. Can you, make some notes about why they might be falling? Have they fallen previously? Are they taking their medications the way they're supposed to? Has there been changes in their vision? Sometimes you got to bring these things up, and sometimes you got to go to the doctor's appointment with them. I'm starting to go to all my parents' doctor's appointments now, right? So you got to start to try to support them in the way that you can. A big one, are they furniture surfing? Okay? That's not actually a good thing. Okay? That's increasing your risk for falling by grabbing onto different things in your home. I don't have to use my walker in the house because I can hold on to this and I can hold on to that. That's a red flag for me, right? When I hear that from a patient, I want to address that. So furniture surfing's not, you don't want to make that a habit, okay? And is the person you care for, are they less active? Okay, then that's getting them going. Let's get up, let's go for a walk, let's do a few exercises, let's, join a community class. I'll join with you, right? There's other things to be doing to keep them more engaged. So once you have those observations, you talk about it, right? And if there's concerns, you go and you talk to the professional people that can help. And then do a walk through safety. If you're a caregiver that doesn't necessarily live in the home, right? Maybe it's your parent, maybe it's your brother, maybe you go through the house and you make suggestions, right? don't think you should have the throw rug here, right? Or making some other, you know, maybe we could clear out this pathway. It looks like some of this is in your way. Let's move this cord, right? Making those sorts of determinations in the home. Okay. How does one prepare for the possibility of a fall? It's important to practice, right? So I would say, get on the floor and practice getting up and make yourself do it. Specificity of training. You get better at doing things the more you do them, right? You want to know that you have the strength and the capability to get up if you need to. Plus, it'll ingrain the procedures in your mind a little bit more, right? You want to practice with different furniture, different rooms, you know, different scenarios, okay? And then it's probably a good idea to have someone present while you're practicing, just in case you can't get back up, right? Okay, all right. Another big one, if you live alone or if you're going to be at home for an extended period of time by yourself, maybe you need to consider a call button or an alarm button. You know, that's important. Let someone know, hey, my husband's going on a trip. I'm going to be home alone. Do you mind giving me a call a couple times a day? If I don't answer, do you mind coming over, right? Those are things to be thinking of. Have a plan in place, okay? And if you live alone, you should definitely have a plan in place. Yep.
A heavy friend of mine fell recently, and there were a group of people trying to help her up, and it was not going well. And I suggested that a chair, rather like one of these, be used in the process of helping her stand up, and everybody rejected my input.
No, I think, oh, we're going to show you exactly why that's important. You need, yeah, you usually need something. If it's someone who's especially someone who's a little heavier set, it's a lot of stress and strain on a caregiver or friends or family in the environment, right? Yeah, exactly. And you want to use the stuff in your environment to your advantage, right? So a chair is definitely important, and we'll show you how to do that. Yeah.
To help you get up off the floor, one thing you should not do is have someone else help you up if you have fallen because you don't know what the injury is. You call the fire department.
Okay, well, we're going to talk about that because there are ways to check to see if you're injured. Now, remember, we're still talking about practicing here. We're not talking yet about what happens if you actually fall and hurt yourself. Different topic, we're going to get to that. But this is specific to the idea of practicing how to do it. Okay? Yeah.
I want to go back to the consider a call button or alarm button. I have the Apple Watch, and it has the fall feature on it.
Yep.
And I got it specifically when I was traveling overseas, and I was by myself in case I fell. And it really, really does work. And if you fall and it's not, and they ask you, have you fallen? You can say, no, I didn't. I just knocked it against the wall or whatever you did. But if you fell and it didn't go off, you could just take your arm and hit the floor, and it will respond.
The other thing are, Siri. Who has Siri in their house? Siri, I've fallen, I need some help, right? I mean, there are these technological advances that can be very helpful for people, especially if you live alone, right?
Will Siri actually make a phone call or something?
Yeah, I think, I don't know Siri specifically, but I know that there are pieces of technology that you can call out to. The Apple Watch is fantastic for this certain type of issue. If you're used to using an old, you have a home phone still, right? Make sure it's positioned in a place that if you were to fall, you could get to. Is it some place you could crawl to and reach up and get to it if you couldn't actually hoist yourself up, right?
We would like to give a lecture at some point on wearables. And we don't know anybody who's really an expert locally. So if anybody here has a contact with someone who is an expert on wearable devices relative to falls and to senior health in general, let me know after the lecture.
Yeah, I'd be interested in hearing about that. Yeah.
I have to say, I watch television a lot, and there's always an advertisement, this woman's on the floor, help me.
Yeah. Oh, and then I can't get up.
Yeah, I can't get up, and then they say, here, what you do. So
Yeah.
I don't know if that's worth it.
Yeah, well, I'm sure there's lots of options out there, but yeah, you know, you can get buttons that you wear around your chest that you just need to press. The Apple Watch, that's an awesome thing to think about, right? Right. Okay, so let's talk about practicing and then strategies on how you would get up if you fall. Okay, so let me, I'm just going to grab the floor here. All right, so let's say, I'll move this forward here. This is, we'll talk a little bit more about what happens in an event of a real fall, but from a practice standpoint, right? If you're on the floor, okay, you have fallen. You want to bend a knee, roll onto your side, onto your stomach, and try to get to your hands and knees. All fours, okay? Assuming that, you know, then you're going to crawl over to a secure piece of furniture. You're going to put some hands up here, and you're going to think about, what's my strongest leg? Okay? I'm going to drag my foot on the ground, bring my strongest leg forward, and then I'm going to kind of push down or pull on the furniture to help me as I push through the heel of that stronger leg. Bring myself to stand, to get my other foot underneath me, turn and sit. Okay? And then, once you've got your faculties, you're going to stand up. Okay? So, having different furniture, you really should have a chair. It's too hard to try, you know, use the environment to help you out, right? Okay. And there are different other ways to do it, like more difficult if you're not going to use an external support, right? You're on the floor, maybe you've gotten to your hands and knees. You get your feet up like this and you walk yourself back up. Okay, that's harder though. The most difficult would be one foot in a lunge position, and then you're going to push yourself up. Okay, you need a lot of lower body strength for that. Okay, so those are a few different types of ways that you could see yourself getting up. Does anyone have any questions?
It all depends on the situation, if you're indoors or outdoors too. I just had recently had a fall about 10 days ago, winter emergency, and I couldn't get up on the outside outdoors.
Right. Did you have something to push into or stand up with?
No.
Right. And that's even harder because, you know, then you got to try to crawl. Right.
Luckily, my husband heard me yelling, "Help me, help me."
Yeah. You got to try to crawl to something if you can. But yeah, it's really hard to get up without having external support. But that might be a goal in your training, right? Maybe you really work on your glute strength. Maybe you really work on your quad strength, and you start to think about ways that, you know, and then you start practicing that. I mean, you can get a chair at home, right? If you can get yourself into this position, can I push on the chair and help me start to learn? You know, and as I do it over time, can I not use a chair, right? So specificity of training, you just try to continue to work on improvements.
I'd like to add something to that. I had an injury, a serious injury several years back, and I had to learn how to get up because my leg was injured. Using my knuckles to get up rather than my hands. Yes. It takes a lot of pressure off your wrists.
Yes.
In
Yeah.
order to get up, and you're much stronger if you're knuckles, it helps me a lot.
Yeah, yeah. Yeah. Some people can't bend their wrists enough to do it, right? Or they've got carpal tunnel or something that's really hard to have your hands on the floor. Okay, let's see. All right, how do you help someone get up after a fall? Do you want to come up, Julie? All right. So if we had if we had the benefits of everything, right? If I'm a caregiver and I, have someone who's maybe at risk for balance issues, I might pull the old gait belt out and put it on, okay? I'm just gonna feed this.
What do you call that belt?
A gait belt, G-A-I-T, yep. Okay, so this will give me something to hold on to. Sometimes like a belt that's, fed through the belt loops works too, but you just want to put that on, make sure it's snug. I usually just tuck this right in there like that. Okay, so what I'm going to do with her is I'm going to have her do the same thing that I just did, right? She's going to turn on her side. Okay, and then I'm going to have her push herself up. I'm going to grab the gait belt and help her come up to sitting on her side. Okay, then I'm going to encourage her to bring her hand forward. And we're going to just kind of use the gait belt to help hoist her up on her knees, right? Help her get her knee underneath her. There we go. Then we're going to, if I can pull the chair closer to her, that's great. I'm going to bring it closer to her or have her help her crawl, okay? Then I'm going to ask her to put her hands on the chair, okay? Now, there's a couple ways we can do this. I'm going to have her bring her strong leg forward, okay? And she's going to push down and pull herself up on the chair while pushing down on her leg, and I'm going to make sure I'm in a supportive position. Good squat. I'm going to help pull her up, maybe to get this leg forward underneath her. Can we bring that forward? And then I might pull this chair. I'm going to pull the chair closer, and I'm going to get her to sit down. Okay? And then we can get her standing. Okay? You might just only have one chair, in which case she's going to put pressure down, and then you got to really use that gait belt to get her standing all the way up, right? And you always kind of want to, once you're to the side of someone, you want to be kind of in this angle here. Okay, these gait belts are really helpful. You may not have a gait belt to help, but they're nice to have around, so it's something to kind of think about. Would you add anything to that?
It can be really challenging if the person is really heavy. Especially if their leg strength is compromised or there's a lot of leg stuff going on.
Mm-hmm.
It can be really, really very challenging. So, what would I say? Take it slowly, think it through. Safety, safety, safety. If the person is on the floor and you cannot manage to get them up, if you feel confident about it, you can sometimes get help if that person can help you and really follow directions. If they're on the floor and you really are striking out and they're just getting more and more tired and you're getting more and more fearful, it's best to call someone else who's in the home or call the fire department or call somebody. Yeah. So there are limits to, we all know that. We've all, us PTs have all worked with people who, well, that just did not entirely work out. So the leg strength and the cognitive being with it is really very helpful.
Also, though, if you don't have a second chair, let's do the pivot transfer maybe.
Okay.
So if she's on her hands and knees right here at the chair, right? And we have her bring her leg forward just like we did the first time. And we're gonna, you know, we're gonna get in a good stance and help her up. So I'm gonna pull this up, right? Well, I might need to help pivot her around, right? So that we can get her here. And then she's sitting, can take a minute, and then go to stand.
I know one thing I want to say.
Mm-hmm.
So, the important thing in controlling somebody else's weight is to control their pelvis, not their arm.
Yeah.
Okay? Or their shoulder. It's the controlling the weight here, and that's why the gait belt is so useful. Because once, you know, if Marianne takes this and she pulls on that gait belt, she pulls me one direction or another, I have to go with her. Because this is where my weight is in my body. It's down low in my pelvis.
Yeah, being up here. I mean, I have a second hand on her somewhere else, right? But the main controlling hand I have is on the back of the gait belt. Yeah.
I'm assuming that if you do one of these exercises and you start to move them and they let out a yell, you just stop and call someone.
Yeah, it's not going to help to be midstream in the transfer. I would, you know, if you've got the strength enough to do it, I would finish it off and try to pivot them. But, well, again, this is practice. We'll talk about what happens when they get, if somebody's injured, right? Because you got to make good decisions whether you need to move, whether you should be the one moving them or not. Okay? Right. Right. So we're going to talk about going through the different joints and checking. Yeah.
In these situations, is shock a factor?
Oh, sure.
So what I'm thinking is that the person who's fallen could get into a very stressed state. Is it advisable to, the classic English thing was to get a cup of tea with lots of sugar in it and have them drink that, so that calm them down. But
yeah.
Not even getting them up off the floor, just to get the stress level down.
Yeah.
So that then the challenge of getting up can
right.
be attacked with a little more energy.
Yeah, for sure. I think that's important. You know, after somebody falls, you need to take a minute to make sure they're okay. Take a minute to take a breath, right? Yep. Take a minute to gather your own self, because it's stressful to see someone fall, right? You got to just assess the whole situation and slow down, right? And let's figure out the best strategy, right? Get the person to breathe, calm themselves down, you know, okay, talk them through the steps too. Don't just go and start to lift them and not tell them what you're doing. They need to work with you, not against you, right? So, okay. Yeah?
I was doing yoga and dislocated my hip joint and fell on the floor and could not move.
Mm-hmm.
And I was in excruciating pain. There was no one else in the house. And I wasn't near a door or my phone. Any suggestions? It took an hour and a half for me to inch my way to a door.
Right. Well, yeah, you got to, you know, once you assess whether something's really wrong, and you'll know if something's really wrong, right?
Your hip, you will know.
Yeah. Yeah, you got to just try your best. You know, maybe you're doing the creep, right? You've seen a little baby just creep on the floor where they sort of pull with their hands. I mean,
that's what I did.
You know,
It took an hour and a half.
it took a long time. Yeah. The other thing, you know, you yell out for help. You bang, if you can get to a close wall, you bang on a wall. You know, you try to do the best that you can in that situation, right? The other thing I would say, in the event that happens and you can't get yourself up, you know, you want to think about keeping yourself warm, right? Make sure you can get to blankets that are nearby, or if there's something within reach that you can cover yourself up and keep yourself warm. If you have to go to the bathroom and you go to the bathroom, Don't lay in it, because that'll make you your body will be cold. So you have to just kind of try to keep yourself warm. So you try to move off of that place, right? Don't be afraid to get help. And if you can't lift someone, get some help, right? Like Julie said.
One thing I do is that when I know I'm going to be doing exercise or something that might get hurt, I always make sure, most of the day, I make sure I have my phone with me. No matter what I'm doing, I live alone, but I have my daughter's phone numbers on rapid call or emergency. But I never go anywhere without this. I go to the bathroom with this.
Yeah.
When I'm in the shower, I have it right by the counter. Because I'm living alone and I'm fit, but still I have fallen, so I never go anywhere without. I'm so happy that our generation has this.
Yeah.
We're the best.
Yeah. I think that's good. I think they're a benefit for sure. Okay, so let's see. I gotta get through this here. So we talked about some of this. A fall plan. If you're injured, use a call button. Use your phone. Use your smart speaker to call for help. Try shouting or banging on the wall. Ensure your family members or your neighbors have access to your house, right? And they have a key or access to a key. That's important. Keep warm. We talked about this. If you can, move to a carpeted area in your house. If you have to go to the bathroom and you go to the bathroom, move away from the wet area. Try to find a nearby blanket. Keep your body moving. Even just moving will keep you a little bit warmer, right? Try to stay hydrated if you can. Stay calm. If there's a fall, stay calm. Take a moment. Check for injuries. So what do? You're laying on the floor. You're going to check your feet and ankles. You're going to pump your ankles. Okay? Then okay, my ankles are okay. Now I'm going to slide my heel towards my butt. Can I move my knee and my hip? Okay, that's okay. Can I move my leg out to the side? Dislocate a hip, you're not going to be able to do that, right? Okay? Take a deep breath. Do I have any rib fractures? Right? Okay? Move your wrists, move your elbows, move your shoulders. Check your head for bumps. Did you hit your head, right? Do you have any vision changes happening at that moment? Those are all things you want to stop and kind of assess before you move at all. And if you're caregiving for someone, run through these steps as well, right? You can, if you're not injured, you can try to transfer like we talked about. If you are injured, you got to try to find a way to call for help, okay? And then keep warm and moving the best that you can. All right. What can be learned from the falls? The 4 W's. What, when, where, and why. Okay? You had a fall, you're okay, but you need to assess what happened. Okay? What do you recall? What were you feeling? Where were you, right? What time of day it occurred? Were you tired, overly stressed, exhausted? Was it in the middle of the night? Was it indoors? Was it outdoors? You want to be writing all these things down. Why do you think it happened? I got up too fast. I felt dizzy. The floor was wet. I had poor lighting, right? Or it was cluttered. I tripped over something. I was rushing to complete a task or go to the bathroom. Was I using my walking aid correctly? You want to be thinking about, what can be learned from the prior fall. And then the fear of falling. Right? We've talked about why it's so important. If you're fearful of falling, you need to take steps to work on that, because that is a fall risk factor. Okay? Why is that? Fear, isolation, depression. You start to be unwilling to engage in social activities with friends or family, right? You stop doing things. You stop being as active. Remaining sedentary will weaken your muscles, creating a vicious cycle that will continue, right? So meet your fears head on. If you need counseling, get counseling. If you need physical therapy, get physical therapy. If you need to I'm not, let's say you're not good about staying with a program. Get involved. Have someone keep you accountable. Make steps. Take strides to change that, right? All right. So what can you do? You make a plan. What happens if I should fall? What's my plan? Talk to someone about my fears and anxiety. Don't set lofty goals that you feel like you're never going to be able to achieve. Set smaller goals, little goals, small things, right? And then you set the next goal, and then the next one, and the next one, until you're maybe doing the big goal, right? Don't expect yourself to go from 0 to 100 right off the bat. You got to take small strides. Challenge any negative thoughts you're having. Stay active. That is the number one thing you have to do. You have to stay active. And then reduce your stress. Find ways to reduce your stress. There's lots of meditation things online you can do. Just basic diaphragmatic breathing really helps reduce stress in people, helps lower blood pressure, all of those things. Okay? So those are things that you can do. All right, so that's the end of it. Anyone have any questions? Nope. Okay.